the experiences. Max you can put are 10 experiences. So really feel, trying to bring this down to 10 experiences helps program directors because they can really focus on the most important experience. Besides the work, research, and volunteer experiences that were present previously, you can choose to have your experience as education training, which basically means for IMGs, their postgraduate training, their residency training in their home country, other extracurricular activity and hobbies. So the hobbies section has now moved. Professional organizations, nothing much. Maybe if you had some kind of a leadership role, you can talk about that. And there are teaching and mentoring experience. So let's start looking at that. These other things like what is the participation frequency, the setting, these are optional. You can see there's no asterisk here. And you can choose how frequently that participation was in that experience, what kind of setting that it was. And these are the primary focus areas, whether it's research, basic science, clinical science, community outreach, I'm not sure about customer service, healthcare, improving access, and so forth, and so many of them. And these are the key characteristics that can be said about each experience. Now, it's going to be very difficult to decide which key characteristic to choose, but do your very best. And I'm going to again share examples here with you. I feel programs might try to filter experiences based on this. So that's one way of looking from the program perspective. And I think they're trying to get more information in an easy to read format. So let's look at the first example, clinical work experience. Of course, on the top, you're going to write the name of the organization, experience, of course. Now, the position title, this is where you have to be as specific as you can. Intern, observer, extern, medical student, postgraduate work, whatever is the right title for you, choose that. And I highly suggest you include specialty in here. So, for example, extern in cardiology, extern in hematology, oncology, that kind of a thing. Because you really want to give as much information from the titles as possible. Start date and it's all very clear. Now it's daily because, from this February 1 to February 28, every day you are doing this clinical experience. Of course, weekends may or may not count, doesn't matter, but at least it was a daily, work that you were doing. Urban, clinical translational science seems to be the best option for this clinical work. And the reason why I chose empathy and compassion, we'll see next. So this is an example of a narrative in that paragraph, and this is what I propose you put when you're describing a clinical experience. What setting it was, inpatient and outpatient setting, under supervision of the name of the attending. This is the only place you can put their name. What did you do in this rotation? Perform history and physical exams, devise treatment plan, presented 4 to 6 patients daily to the resident team, documented progress notes in EPIC EMR. So 2 things you'll note. I'd like to describe that you interacted with residents, fellows, and attending. It gives a sense to the program director that there was some teaching, some education involved here. The EMR is super important nowadays. You really want to show familiarity with the EMR, whether it's EPIC, eClinical Works, Cerner. Definitely include that in your narrative. Third point, devise differential diagnosis and strategies for evaluating hematological abnormalities, all this anemia, thrombocytopenia, assisted in bone marrow biopsies under the supervision, presented. Now, what was something unique this applicant did? Presented a review of tumor lysis syndrome in a noon conference. And then they gave a little bit more description, learned about stem cell transplant indications, complications, and so forth. So this is a very nice, very comprehensive narrative description of what this experience involved. And you remember the character count, 1020 character count. I looked at it, I think this was about 700 characters. And you can see it's all presented in a bulleted form. So again, I discourage applicants from writing this as a paragraph, write it in points, just like what I've shared with you today. So if, again, you want to look at what's a good format, that I recommend for writing the clinical work experience, 4 to 6 points. Again, try to keep it as concise as possible. We want to respect the time of the program director. This is write the setting, outpatient, inpatient, name of the attending, that you interacted with just the attending or the resident team. What were the activities you performed? H&P, progress notes and EMR, rounds. Maybe you did night calls, so talk about it. What was your work? Medications, labs, radiological studies. Patients you saw is a bit optional. I'll leave that to you. Or if you were doing an observership where it's, you're not really directly interacting with patients, you can say directly observed, participated in daily rounds, and discussed management of hospitalized patients. Talk about something unique that you did. I presented a review of this. I presented a review of that. And education, I participated in the morning report or a noon conference. I think this is a very nice, comprehensive, narrative that you can put when you're trying to describe the context, roles, and responsibilities. Here's another one that I'm going to share, clinical work experience. So again, just like the last time, write the position title, include the specialty in the position title. And let's see here. This is more of critical thinking. This is another example. This is in cardiology. Performed history taking an exam of patients with diverse cardiac conditions in outpatient clinic with Dr. So-and-so. This seems more like a clinic rather than a university hospital. So it just says cardiology attending. Presented patient assessment and plan to the attendings, age and comorbidity screening, reconciliation, vaccination reviews, kind of whatever they did. Learned the indications and interpretation of this, echocardiogram stress tests, correlated these findings with the clinical presentation, recorded SOAP notes and e-clinical work. So this is exactly what I was saying. You have to include the EMR that you're familiar with. Conducted daily consultation visits. They did something unique. They presented a review of the Takotsubo cardiomyopathy to attendings, nurse practitioners, and externs. That's kind of how a clinic is set up. And they assisted in EKG's stress test. So this is a very nice narrative. And I really don't think you should write more than what I've described in these two examples of clinical work experiences. Okay, now this is about an internship. So clinical work experience, a lot of IMGs do internship in their home country. So you're going to write your name of your med school there as an organization, position title, intern, clinical intern, if you want to write, that's fine. 1 year time period. Sorry, the start date is wrong, but 1 year time period. And daily recurring critical thinking and problem solving. That's kind of what's typically done in internship. So this is how a narrative for that 1 year internship would look like. As part of the internship, I rotated in internal medicine, pediatrics, general surgery, anesthesia. This is the name of all the specialties. Participated in all aspects of patient care, daily rounds, diagnostic planning, this and that. Monitored patients, wrote notes, admission order, discharge summaries, morning rounds, handoff, and did these procedures. And again, this I feel is very comprehensive. Really nothing more than this needs to go in your ERAS CV. So we saw 2 clinical experiences, US clinical experiences, 1 internship from med school. Let's look at the 4th experience, which is going to be a research experience. So again, name of the hospital, research assistant. Will be nice if you can include specialty here. And again, daily recurring. This was something about quality improvement. So let's look at this. Now, this is shorter than the description of the clinical work experience. Assisted in research activities, GI and hepatology with attending, name of the attending. Just in case a program director might recognize that the name of that attending, it's always nice to include their name. Performed literature search, analyzed the papers for the manuscripts, abstracted data on research from the EMR EPIC. I mean, that's kind of how their study methods were. Collaborated with biostatistician for these projects, and natural history of NAFLD, role of FibroScan, and the outcome presented 2 posters at this conference, Digestive Disease Week and ACP Michigan. So the format for research work experience is as follows: 3 to 4 points. This is, remember I told you this is shorter than the clinical work experience. 1-line summary of the study design and the objective. What was your research role? That's the most important. Data collection, formal analysis, investigation, writing, review, editing, and so forth. If you're the first author of that research work, it deserves special mention. So definitely include that. Funding, if you did get that, and status of the research, whether it's presented, published, where exactly is that research work in the journey to getting published. You absolutely have to describe that. You don't have to talk about what were the findings of the research. There was one application I reviewed, they were talking about the p-values and everything, and that's absolutely not needed in a research work experience. Leave that for the interviews where they might ask you, what did you find in that research, and then share it at the interview, not here. The focus is on the research role, so try to make sure you describe it as best as possible, like in that example, and these are the terms that you can use in that description. All right, then this is another example of another research assistant position, and daily recurring public health, ingenuity and innovation. And this is because they took a little bit more active role in this research. Participated in research projects studying the association between patient knowledge of A1C and the diabetes control, that is their actual A1C level with Dr. So-and-so. And contribution, this was the questionnaire creation, literature search, interviewing, data collection, writing, abstract and poster creation. So you can see the lead author in the abstract. Remember I told you, if you're the first author, take full credit for that and include that. Abstract has been accepted for oral presentation at so-and-so clinical meeting. So this is a nice, concise description of the research work experience that you can put in the ERAS CV. And kind of, again, the 4 points is very nicely written. What about volunteer experiences? Let's look at some. So this is an organization. You're going to have to, give the name. I cannot give the real name of the organization, so I just made this one up. And volunteer medical student. And the focus area was community involvement, communication. So KLM is a volunteer-run humanitarian assistance, disaster response joint operation in the US and Haiti. I participated in a 7-day mission and served as a medical interpreter between French-speaking patients, American English-speaking physicians, helped with triage, emergency medicine, cardiology. Again, you'll notice this is even shorter than the clinical and the research work experiences. Volunteer experience is just 2 to 3 points, no more than that. That's all you really have to do. Try to keep it as concise as possible. Here's another example. About volunteer experience, Rotary Club India, position organizer of the health camp. So this is a very good title. You're kind of showing a leadership role in this way, and the date and everything, teamwork. So yeah, if you can use words like organized, led, those are strong words. So try to use that in the narrative. Organized the Rotary Club Diabetes Screening Health Camp in a village 20 miles from my med school. I led a team of med resident students and nurses and arranged transport and supplies. This team screened the local participants for diabetes, hypertension, and provided health advice on lifestyle changes, healthy diet, and primary care follow-up. Nicely written, short, concise, 2 to 3 points. That's all you need to do for volunteer experience. Now, another entry is a teaching or mentoring. If you had a teaching role, this is also a very nice experience to include in your personal statement, something like this applicant did. Medical school name, teaching mentoring, class vice president. So, and all this is there. So this is what this applicant did, served as student representative in faculty meetings to discuss educational improvements, introduced case-based learning and pathology, team activities, problem-based solving. Based on my efforts, our school's average score increased to second best. So this is very nice. They're trying to give an outcome that they were able to achieve through these efforts. I created a shared Google Drive containing recorded lectures and study notes in Q&A format for discussion. So again, nice and short, 2 to 4 points. It's good enough for teaching and mentoring. All right, hobbies. This is a big one. So let's look at this. Music. I've been playing guitar since high school and can play acoustic and electric guitar in rock and Indian pop music. I also play in local venues with a band and taught guitar to middle school students. Dance, I learned Indian dance, Bollywood Bhangra style in dance academy, participated in group and solo events. Hiking, I'm proud of my 6-mile hike on Snake Mountain in Massachusetts. Yoga, I practice hot yoga every week in a group. I'm a yoga teacher and conduct beginner classes for children. 3 to 4 hobbies, I believe, is very good, is enough to include in your ERAS CV. No more than that. Only describe hobbies that you're very passionate about, that you can really describe in detail if someone asks you, and do provide the details like what we saw in these examples. Music. Okay, I play guitar, I play acoustic guitar, I play electric guitar. This is the kind of music I play, and I do teach other students. It's a very good description. Don't write things like I like music, and that's you have to give more details, because you really want to show that this is something that's of interest to you. Program directors are very interested in hobbies because it gives a lot of human touch to you. It kind of, when we look at hobbies, it tells us about you as a person. What are your interests? It also tells us how you're going to handle yourself, especially during residency, when there's so much stress and burnout that's described. So we need to make sure that you have hobbies that you can take care of yourself and have emotional well-being, and provide the details. So I don't want to read CV that says love to spend time with family and friends. No, that's not a hobby. Or I like to read books, I like to watch Netflix. No, those are not hobbies. You have to show creative hobbies that you're active in, and describe in your ERAS CV. So those were the 10 experiences that you can include. Of course, you don't need to use all of them. You can choose 9, but I would highly suggest, do your best, show that you're well-rounded, show as many kinds of experiences in your ERAS CV. Now, the next section is called Meaningful Experience. What's a meaningful experience? And ERAS allows you to choose 3 of those 10 experiences to be included under meaningful experience. So when you write your paragraphs here, you're going to have to specify that this experience identifies with this experience. I'll show you examples. Now, meaningful experience means that you have to describe why it was meaningful to you. Why was it valuable to you? How did it help you? You don't have to write about what skills you learned. They've described it very well in the instructions. So don't focus on that. I'm going to show you some examples. Again, remember 300 characters. So if people on Twitter, they know it's like 280 characters. So it's like writing a tweet, really. Okay, meaningful experience. So this is for that first experience about HEMONG, clinical experience. Observing Dr. Anderson's honest conversations with patients with terminal cancer about prognosis and goals of care taught me empathy and compassion. End-of-life meetings in the rotation helped me appreciate that the physician's efforts should be directed not just towards the quantity, but also quality of life. You can see only 2 sentences. This is kind of like maybe 280 characters or so. And that's why this experience was meaningful to this applicant. If you recall, I wrote that the kind of characteristic was empathy and compassion, and it's because of this. Another meaningful experience. My first US clinical rotation was a steep learning curve for me, both personally and professionally. In a week, I learned from students and residents to communicate effectively with patients and physicians, present on rounds, and document in EMR. This experience made me proud of my adaptability. So again, we're talking about why that rotation was meaningful to this applicant. If you want some hints, what you could do is just go here. Let me show you where, on how to write this, and look at these key characteristics. These are the characteristics that will be highlighted in that meaningful experience. So for example, I talked about empathy and compassion, and then the other one was this resilience and adaptability. That's what I'm trying to describe in this meaningful experience paragraph. Let's look at another example.
Lead USMLE tutor in 3rd year of med school, mentoring medical students, step 1 Spanish English, modeled discipline and perseverance, made a profound impact.
So they're trying to describe why that was meaningful because of the leadership skills that they built, that they're describing here in this meaningful experience. So these are some examples of 3 meaningful experiences that you can describe about those experiences. The reason why it's important is because this paragraph, the first one about Dr. Anderson, that was linked to that first experience. Remember the one about the hem-onc rotation? What happens is if you link it that way, that work experience is the first thing that the program director will see. So having a meaningful experience, it prioritizes that experience that the program director is going to see. So that's why you have to be a bit careful about deciding which of those 10 experiences should be listed under meaningful experience and have narratives like this. Because those are the ones that will be much more clearly visible to the program director. And that's, again, it says that in the ERAS CV guide. Okay, now the next one is impactful experience. Yeah, so the impactful experience, that's another paragraph. Again, this is optional. The meaningful experiences are optional. The impactful experiences are optional. But I do feel we should take advantage of this space to kind of talk about, our experiences. This one's all about challenges and hardships. So difficulties that you had throughout your life until the point when you apply for ERAS. And I'm going to share some examples here. So the keyword is hardship, okay? Let's look at impactful experience number 1. Let me move this to the side. In my 3rd year of med school, my mother was diagnosed with breast cancer. As the only member of my family in medicine, I took it upon myself to face this challenge head on. I accompanied her to meetings with the surgeon and oncologist. Many options were presented that terrified her. I advocated for her to undergo mastectomy based on my literature search and curbsiding other mentors, trying to show an active role here. I assured her that I will always be by her side in this fight. I also balanced my medical school studies and keep up with my classes and tests. Her successful recovery inspired me that being resilient in challenging times and getting support from peers and family are powerful enough to overcome any adversity. So again, it says 1,020 characters. So you have to kind of, you have to write this as an essay, really. And so this really talks about the difficulty and how this applicant handled that difficulty, really showing resilience and had a very good outcome as a result of this at the end of this challenge. Let's look at another example. Again, the key word is hardships. Remember that. Impactful experience number 2. As the first generation physician in my family, I encountered my own set of challenges and opportunities. Growing up in a rural village of Nepal limited the educational opportunities. My parents, who were agricultural workers, appreciated the value of high quality education, supported my studies in residential school far from home. I worked hard to achieve the scholarship from Government of Nepal that covered my tuition fees in med school. I experienced tremendous personal growth in med school and pushed myself to get out of my comfort zone. In addition, the scholarship mandated 2 years of rural service that allowed me to give back to my community, and that continues to support my journey to US residency. So again, talking about the hardship that this applicant faced before starting this journey to US residency. All right, let's talk about the next part, which is about geographic preferences. This is something, again, that's new in the ERAS for 2024. Now you can choose which geographic region you prefer to do your residency in, Pacific, Mountain, and so many out there. Now you can choose up to 3 geographic regions. And whenever you do that, you have to give a description, and I'll kind of share some examples there with you. You can choose to say, I do not have a division preference. Again, you'll have to write some narrative about that. Or you can skip this section completely, and then no information will be provided to any program. So you have a couple of options. Let's look at some. So I want to explain to you what the choices mean to the programs. So say the applicant is applying to a program in Philadelphia and Chicago, and they give these preferences: Middle Atlantic geographic preference, East, North, Central, which includes Illinois. Okay, so If this is the geographic preference and these are the programs they apply to, the programs will get this message: the applicant prefers Middle Atlantic. So just the region that the Philadelphia program is in. And the Chicago program will get the message: applicant prefers East North Central, that is Illinois. They're not going to know about the other regions that the applicant may or may not have chosen. Say the applicant did apply to these two programs, but preferred the Middle Atlantic and the West South Central, that is Texas. So here in this situation, the Philadelphia program will get the message: applicant prefers Middle Atlantic. Chicago is not going to get any information. Okay, so the Chicago program will not know whether this is their geographic preference or not. It'll be blank. If this applicant just chooses, I don't have any preference, the Philadelphia program and the Chicago program will get the message that the applicant doesn't have a preference. If you leave it blank, no information is shared with the programs. So this is important to know what is the impact of the choices that you make under geographic preferences. Typically, you will choose these geographic preferences based on family, friends, familiarity, and I can share examples here with you. The reason why it's important to know about this, in the last 2 years when the ERAS was doing all this research, they are saying that your chance of getting an interview invite is greater if the geographic preference that you give matches where the program physically is. So if you say, I want to be in the Philadelphia, what's the name of that? The Middle Atlantic. If you want to say that, if you say want to go to the Middle Atlantic region and apply to a Philadelphia program, your chance of getting an interview invite goes up. And that's what exactly they say here as a conclusion. Applicants whose geographic preference aligned with the program location were more likely to be invited to interview than applicants whose geographic preferences did not align. So keep that in mind when you are deciding upon your geographic preferences. And here's the narrative that you can write for the geographic preferences. Now, this is someone applying to the New York region. My best friend from med school works in Long Island, New York. I prefer to be in the Northeast region to be available to visit her often for social support during residency. And this is very desirable. The reason why geographic preferences are being given so much weight nowadays is because they want to make sure you have social support, friends, family, because this is like the biggest negative predictor, the biggest deterrent to burnout. And so that's why programs want to make sure you have someone in the region, someone that you know. And this is a very desirable. Another reason you can give for a geographic preference: I completed an observership in Worcester, Massachusetts. I prefer to be in the Northeast region as I'm familiar with the New England culture. I also love the 4 seasons, opportunities, outdoor activities, hiking and skiing. You can give that example. And this is a little bit another example that you can give. Growing up, I often visited my grandparents in Atlanta, Georgia. I love the Southern hospitality, multicultural diversity, and warm climate the South Atlantic region has to offer to me and my wife. So it's okay. You can certainly talk about this also if that's you have a preference for that region. If you don't have any preference, you still have to write a narrative. You can write something as simple as this: I do not have any preference. I'm willing to relocate for the right opportunity. Again, I highly suggest you identify geographic preferences and give reasons like what I've shared here with you. You choose, I do not have geographic preference, kind of not the end of the world, but at least from the data that we have seen, if you have a geographic preference, the worst things that's going to happen is a program that's outside the preference, the region, is not going to get any information at all. They're not going to find out anything bad about your choices, about your preferences. And giving the geographic preferences and applying to programs in that region, at least from the data that we're seeing, you do have an increased chance of getting an invite. This is a very interesting graph shared in one of the ERAS webinars, where you will see that programs that are in a certain region and align with your geographic preference, they are likely to offer you an interview. But if you do not have a geographic preference or the geographic preference is not aligned, then the chance of interview is lower. And very similar, if you see. I've seen this graph for a lot of specialties, and they're very, very similar. And I've chosen internal medicine. Why this is important is because last year, some experts were saying choose no geographic preference because you might offend like that program we talked about. So if someone said, I want to be in Texas, but this program is in Chicago, so you don't want to offend that program. And that's why some experts recommended that last year. But based on this, you will see that it's more preferable to give some geographic preference and at least get your chances increased for the places where you want to be, because saying I don't have a preference is as good as that program was outside the geographic preferred area. So that's why my recommendation is always choose 3 regions where you want to be. And what are those 3 regions? Of course, that's difficult to say, but these are based on the data that's out there, which are the IMG friendly states. They're listed on the left. So your geographic preferences, at least like the first could be middle Atlantic, second could be east, north, central, and third could be something else. But what I'm basically trying to say to everyone, don't say I do not have a preference, or don't leave it blank. Use it, because programs in the region where you apply will like it and are likely to invite you for an interview. So don't lose that opportunity. There's another thing called setting preference. Not much has been written about this, but it's basically suburban, urban, rural setting that you prefer. Now, I've given like these 3 regions: Pittsburgh urban, Burlington, Vermont suburban, and Greenville, Ohio rural. Okay. If the applicant chooses suburban and urban, all the programs will get to know that this is your preference. Suburban, urban, and so forth. There is a preference for suburban/urban, so you can certainly choose that. You don't have to be specific, just suburban and urban. Okay, so I just want to let you know. I don't have any preference, so all the programs are going to know that you don't have a preference, or you can be blank. Yeah, so don't apply to a rural program if you're choosing the suburban/urban, because this is a message that they'll get, and of course they're not going to invite you if they find out that's not your setting preference. Signaling. So of course this was present in the last 1 or 2 years also, and these are all the different number of signals that are allowed. How does signaling help? Again, this is data from ERAS, and it says that applicants who signaled a program were more likely to be invited to interview than applicants who don't signal a program. Now, this is not universal. If there's like a very popular program and they're getting too many signals, then it kind of becomes very difficult to understand who's really interested or not. But in general, if you look at all the data, it does say that the signal is for a way of showing your interest. Now, the one thing that has changed from the previous ERAS application was that I believe previously applicants were discouraged from sending a signal to places where they've done their rotation, or places that it's called a home program. I mean, if it doesn't apply to IMGs, but for US seniors and graduates, they were kind of discouraging them from choosing their own home institute for signaling. But that's changed. Now they encourage you to specify a signal, those programs where you've done your rotation, and show that interest. So signal a program. These are my recommendations where you really want to work. Don't signal a program just for fun and just to kind of see if you have a chance, but you really don't want to go there. Don't waste your signals. They're very, very precious. Signal a program in your geographic preference. We saw some of the data that signaling a program increases chance for interview. Having a geographic preference and applying to a program in that region increases your chance for interview. And having both, that is signaling and geographic preference, to a program, if they match with the program, that really increases your chance of interview invitation. So take the most benefit of that. Signal a program where you have non-zero chance of matching. So if it's a very, very research-heavy institution and you don't have a research experience, or if it's in a, if it's a very kind of a program which is a very top-notch program, very competitive program, maybe with very few IMGs or no IMGs, then try to really decide if you have any chance of matching there. If you have a zero chance of matching there, then don't waste your signal there. Signal a program where you had clinical and research experiences. That's exactly what I was talking about. Signal a program where you can confidently answer the program director, why are you interested in our program? Because they will definitely ask you that at the interview. So you need to have very good, very personalized, very clear reasons to say why you're interested in that program. So there have been changes here also, and that has to do with the number of signals, and it's called the different tiers of signaling. There's this gold and silver signaling. So especially for internal medicine, a lot of you may be applying to internal medicine. Last year, there were 7 signals, just signals, but now there are 3 gold, 12 silver signals. Now, ERAS had a webinar on this trying to explain why these changes were made, and that the changes were made based on feedback from the residency applicants saying, we don't have enough signals, and feedback from the program directors because there were like a small number of programs that were getting a lot of signals. So if a program, say, is getting say 2,000 applications and say 500 signals, it's very, very difficult to understand what to do with the signal. Should that program recognize a signal? Should it not look at the signal? It becomes very confusing. That's why ERAS, decided to increase the number of signals. I'm taking internal medicine as an example, and have 3 gold, 12 silver signals. And it's being described that gold basically means most preferred program, and silver is, yes, I'm interested and it's preferred. But they're trying to divide it that way. And I'm sure we'll come, this has just started just like 2 years ago, so we're still all learning from this, but that was the intention of doing that. People have done different strategies about signaling programs. Some will signal, say if they have, how many signals were there? Let me go again. So say 3 gold and 12 silver signals. So 12, they might say, okay, 6 programs for places where I want to be, 6 where I don't want to be, but I just want to try out, say it's a university program. I just want to give it a shot. I don't think that's a very nice way of using your signal, because you really want to make sure you want to work there and have some chance of matching there. So use it very, very judiciously. These are very valuable signals because, it's helping applicants get a chance for an interview. Honors and awards. So this has also been upgraded. Last year, they would give a text box and you would describe all the awards. But there was a lot of confusion, even in the ERAS CVs that I reviewed. I would not know why they got an award, why they got say a certificate of honor award. The details were missing. They got it because they scored the highest in their exam or in the 10th percentile among so many students. So that information was missing. So I believe they have tried to more streamline that by now having you choose, okay, what kind of award did you get, and description and date. So let's look at some examples. All this other honor societies and all professional is the same, but there's another section that's been removed called other awards and accomplishments. And I think that's good too, because people were, including stuff from like high school and so forth, which is not really needed in an ERAS application. So this is one example of an honor or award. Academic excellence, gold medal for best outgoing student, awarded for highest score in final year in a class of 150 medical student, and the date. This is perfect, and this is the amount of detail that they're looking for. Another example is scholarship. So, many IMG colleagues from Nepal, they get scholarship from the government. So full tuition scholarship, awarded full tuition scholarship by government of Nepal to pursue MBA. So this is very nice, very clear, and a program director will exactly know what this award was about. Okay. The extensions and the interruptions. And earlier in ERAS, it would basically, the question was, have you had any extension or interruption in med school? Yes, no, and give an explanation. But there is this word here that's making it very confusing. There's a word called unplanned professionalism or academic issues in your med school or training. I feel that this word is helpful for international medical graduates because some of you might be extending your med school, especially the internship part, to come to the US to do rotations and electives and so forth, or taking USMLE, because that's not unplanned. That is planned, that you are extending your education because you want to do these USMLE or US clinical experience. So I feel this is helpful having that word unplanned. But what are some situations where there are some unplanned events that are extending or interrupting education? Let's think about that. So some of the applicants I've worked with in the past few years, for example, there was one medical student from a Caribbean med school, and that med school lost accreditation, so they had to change schools, and that whole process extended the entire duration of their med school training. Was war, so I've had an applicant from Ukraine and in European countries, and some natural events where you don't have any control over, those can cause extensions. Need to retake exams in med school because of a failed attempt or for medical reasons, both personal or maybe taking care of a loved family member. That might be other unplanned reasons to extend the education. I always suggest that it's nice to look at what your MSPE, previously called the Dean's Letter, is saying, whether you have truly extended it. Because despite everything you have done, if the MSPE is not saying that you have extended your med school duration, then you're good. Then you just have to select no and go from there. All right, let's move on to research citations. So for journals that you have authored, write down your name, enter all author names. They describe how to present those names: last name, comma, first initial and middle initial. Now the thing is, if you have many authors, it's going to be a little bit difficult for the program director to find your name among the so many authors. So one strategy is to capitalize your name among the list of the authors. This way, it can be very easily read by the program director. Some residency applicants even put an asterisk next to their name so that I can quickly find, that applicant. I can quickly find that applicant's name in the list of authors. So keep that in mind. Publication name, write the full name of the journal. Don't abbreviate, because some may not be familiar with that journal. All this information is very clear. Now, the others category is this one: peer-reviewed journal articles, abstracts other than published. Now, the first thing is you cannot list a paper if you have not submitted that to a journal. So your job is to be as accurate as possible on the date of submission. So on the date of submission, that may be even like a day before ERAS allows programs to download your application. You can certainly describe the most current status. If you've got it to the submission stage, if you're able to submit that paper to a journal even a day before ERAS, you can certainly write that the paper has been submitted. But otherwise, if you're still drafting it, there's no real place for you to describe that paper, maybe under research experience, but you can't really cite that paper here. Okay, then the other research category is the poster presentation. Now, the poster presentations refer to the posters that you presented at a national or an international conference, maybe even like within the med school. I think that's still very valid. But, one question, at least among IMGs, is posters that were presented as a requirement of your community medicine, preventive and social medicine rotation. No, that's not really research poster presentation. So don't include that in your ERAS CV. The non-peer reviewed online publication, this is where you can write about any blogs or you might have written. I think that's still very valid. Anything that you may have published online related to clinical medicine, you can certainly describe it here. Don't overdo it. If you have like 10, 20 blogs, just maybe the most 3, 4 most pertinent, most important ones, just describe that. Okay, let's look at the last two sections, which is the work authorization and then the language. So the work authorization for many IMGs might be that they're not authorized to work in the US. So one question that I commonly get is, should I choose H-1B versus J-1? And this is a very personal decision. If there is any reason that you absolutely do not want J-1 visa, then don't check the J-1 visa box. And if you're okay with either J-1 or H-1B visa, kind of mark it the way I've done it here, and that's perfectly fine. Now, the decision is going to be yours if you want to give priority to the H-1B programs versus the J-1 programs. That's entirely your decision. Okay, language skills. Now, what's very important is you need to have an advanced level of proficiency in English or higher. And I think, and like I said, in the last 4 years, what I've been doing this, there has been, I think, one applicant who chose good, and I had to tell them this is gonna, make it difficult for them to invite you for an interview, because they, at the very least, they want advanced English communication skills. So please work hard to get to that level, which is explained here, because that's very much needed in your daily work and communication. So I'm very glad they did this, because then there's less confusion. The next part is this: which of the language do you meet or exceed the good level of proficiency? So this is nice also, because I also, like many applicants, took some Spanish classes online, and would write, I know basic Spanish or fair Spanish, and I couldn't even speak a sentence. But now, because the word is now good level of proficiency, where you can need to at least have a conversation, they are really cutting down on people who will choose basic or fair just with the little knowledge of the different language that they have. So I think these are good, and there'll be less confusion now moving forward. So that's very nice. Thank you very much, everyone, for being here, and yeah, wish you all the very best.